Assemblymember Latrice Walker. And for today's program, please welcome the delegate for 1199 SEIU, Michelle Need. Please welcome the president of the Healthcare Association of New York State, B. Grouse. Please welcome Interfaith Hospital and Greater New York Hospital Association board member, Ari Moma. Please welcome the president and CEO of the Greater New York Hospital Association, Kenneth Rasky. Please welcome the CEO of One Brooklyn Health, Dr. Sandra Scott. And please stand and join me in welcoming the 57th governor of the great state of New York, Governor Kathy Hochul.
All right, how's everybody feeling this morning? This afternoon, actually. I am Dr. Sandra Scott, the CEO of One Brooklyn Health, and I thank all of you for joining us today for this very critical conversation around cuts to the federal funding for health care. On behalf of One Brooklyn Health and our board of trustees, I thank Governor Hochul and Congressman Hakeem Jeffries for their leadership in this very, very, very important fight. Cuts to Medicaid will significantly affect our most vulnerable, who rely on institutions like One Brooklyn Health for their well-being and their health. Cuts to Medicaid will also impact those who rely on Medicaid for long-term care. And we know that our populations are aging, and it's extremely important that we take care of those who took care of us. So, without further ado, it is my honor to start today's agenda by welcoming the Honorable Kathy Hochul, our 57th governor. Governor?
Thank you so much. Thank you, Dr. Scott. I wish we could have joined for a more joyous occasion, because right now we're at war. We're at war to protect our people. And I'm sick and tired of Washington thinking that we're going to be the collateral damage in their weaponization of programs that we've relied on for nearly 60 years and cut them so they can cut taxes for millionaires and billionaires. We're not putting up with that because we are New York. And there's no place I'd rather be than right here, joined by leaders, bold leaders of New York State healthcare organizations and the heart and soul, our healthcare workers. And I want to thank everyone who's joined us here today. First of all, our host, Sandra Scott, and your entire executive board. I am so grateful as the leader of this state for all you do every single day. It is hard, and you see people at their most vulnerable, and yet you give them compassionate care, and I am so grateful as your leader, and we're going to continue going on and on and on, and I want to give you another round of applause. Thank you very much. Yeah. Ken Rasky, the president and CEO of Greater New York Hospital Association. Ken, thank you for the challenges that you must encounter every day as we work together to deliver for New Yorkers. And also, B. Grouse, the President of Healthcare Association of New York State. B, thank you for representing so many important institutions. Ari Moma, you'll be hearing from a nurse at the Interfaith Hospital and a board member. Michelle Ned, the in-service coordinator and 1199 delegate. And also, Assembly members, my partners in Albany, Latrice Walker and Stefani Zinnerman. I want to thank you for all you do for us and for fighting for our communities. And you notice there's one person missing who's on his way, I assure you. He may have had a little longer commute than I did this morning. But again, when I think about the healthcare workers, you're truly God's angels on earth. I mean, you're doing so much. And I know it's sort of in the rearview mirror for a lot of people. I'll never forget what you did during the pandemic. You are frontline workers. You showed up when everybody else was too scared to leave their houses. You saw death every single day, images that'll never escape you, that sometimes still haunt you. And we must acknowledge and recognize that what you've been through. And you deserve more than pots and pans banging and a thank you for your service. You deserve to have everything we can offer you and lift you up and show you our gratitude as a state. So another round of applause for all of our healthcare workers here and across the state. And I'll thank him when he arrives. I want to thank Leader Jeffries. You know how fortunate we are to have the leader of the Democrats in the entire House of Representatives, our own New Yorker, our own Brooklyner. He understands us. And when he speaks from the heart, he's embodying everything he learned in the streets of our great community. And that is why we are a stronger, better country, because of his voice. And he is taking on this fight. And I'm so proud he'll be joining us momentarily. And he's united Democrats against the largest health care cut in American history. And we are not standing down. And also, House Republicans going after Medicaid. Let's think about what that means, who they are standing up against now, and what we must do against them. They're taking a wrecking ball against vulnerable children and families and senior citizens and people who are too sick to work. If we can't take care of them, what does that say about us as a nation? And why do they need to be the collateral damage in these wars? You know, New York State alone stands to lose $13.5 billion. This is not conjecture, it's not speculating. This is what's in the House Republicans' plan right now. And our only hope is the Senate. Heaven help us. But they must hear the pain of their own constituents and those who represent the red states. There's a lot of rural poverty in their jurisdictions. I know they're in New York. Part of New York is literally defined as Appalachia, about 11 counties. I used to represent that area in Congress. The rural poverty is great. Our urban poverty is great. And if we can't provide the dignity of just being able to get back good health when you're sick, when we know how to do it, it's not that we don't have the cures or the treatments or the care, but if it's inaccessible to you because you don't have the largest insurance program available to you, we have 1.5 million New Yorkers who will be off of Medicaid because of this program. What is supposed to happen to them? I'll tell you what's going to happen. They're not going to get preventative care. They're going to end up in our emergency rooms, overcrowding the hospitals. And guess what, everybody who's not on Medicaid? They're going to make it too crowded for you and your families when you need care. That's why there's a ripple effect to this. So those who are not on Medicaid, so that doesn't affect me, I'm okay. This is going to cripple our entire health care system for everyone. And that is not just pie in the sky or Chicken Little. It is going to happen. And it's a lifeline. You know, 1 out of 3 New Yorkers receive Medicaid. Half of all of our kids. Now, you've heard me say this. I'm a mom. I'm a grandma now. Got another one on the way. Keep at it, kids. This is good. Grandkids are definitely more fun. I won't say it to my children, but when I see a baby, you know, it's impossible for me to not go up to that parent and just want to embrace them and tell them, you know, these are scary times for you. It's expensive to be a parent. You know, the diapers and the formula and the little kids' clothes, and I know what that's like. And now to think that your own baby, your most precious person in the whole world for you, won't have the health care when they get sick? What are you supposed to do? Watch them possibly die? That is so inhumane. This is a first world country, are we not? Do we not have the abundance, the resources to take care of our little kids? Is that what they're telling us in Washington, that they can't do that? Heaven help us. It's also people's grandparents in the nursing homes. I mean, who can afford the nursing home care? And God bless them as well. Hard work they're doing. But do Republicans think that mom and dad or grandma and grandpa are going to come back home, live in their spare bedroom? Are they giving up their jobs to take care of them? How does this work? What's the end game here? They're clearly not thinking beyond taking care of their millionaire and billionaire donor friends, are they? They're not thinking about the ripple effect throughout society. You know, even a mom with a high-risk pregnancy, I've done so many events. Latrice Walker and I have talked about this a lot here in Brooklyn, about the high rates of infant and maternal mortality. And so much of it is preventable, about getting those regular appointments because you have health care, right? And in New York, we're the first state in the nation that says you should be able to get paid time off work to get care, prenatal care before the baby comes. They'll give you a better outlook, better outcomes in life. Those are our priorities. And yet, Republicans want to take that all away. Have they no heart? No compassion? Were they not raised in a country where we take care of each other? You know, just a few weeks from now, July 9th, we'll be observing the 60th anniversary of when President Johnson signed Medicaid into law. He also did Medicare. And those two events lift more people out of poverty almost overnight. Our seniors were the highest population living in poverty before those laws were passed. And now today, that is no longer the case. Now it's our kids. Now it's our kids. You know, what President Johnson said stuck with me when I read this a few times. He said, there's a tradition we share. It calls upon us to never be indifferent to despair. It commands us to never turn away from helplessness. It directs us never to ignore or spurn those who suffer in a land that's bustling with abundance. That is us today in 2025. We are a land bustling with abundance. Republicans call it reform. It's basically Robin Hood in reverse, right? Yeah. Taken out of our pockets. People need help. Giving to the rich. So here in New York, we're doing the exact opposite. We're focused on safety and affordability, taking care of our families. And I expanded the eligibility for the Essential Plan, which gives now more than 1.5 million New Yorkers access to high-quality, affordable coverage because they deserve it. You know what our uninsured rate now is? It's 5%, one of the lowest in the nation. And we're not staying satisfied with that, but that is one of the lowest uninsured rates in the nation. So I've invested millions and millions in health insurance subsidies, financial assistance for our hospitals that are struggling so much. They didn't anticipate all these costs, and protecting low-income families from medical debt. Also directed billions of dollars in a safety net transformation program to expand and make sure we have affordable, high-quality care. But now all that is under threat. And you know, they're all talking about this fraud and waste and abuse. They're talking about $50 billion they've identified. If you found even $50 billion, which I think you're making up, then why do you have to cut to $850 billion? I mean, explain that. Okay, let's grant you the $50 billion, which I actually don't grant you because I think you're making that up. But why do you need so much more? Oh, because it's for the tax cuts. It's for the tax cuts. And all of a sudden they have this, we're worried about the national debt. Then why are you adding $3 billion to the national debt? They're just making this stuff up. I caught myself. Okay, caught myself. Don't get me on a roll. What Washington doesn't understand about New York is that we do not abandon our people. We will not walk away from them in their time of need. Health care is not negotiable in the Empire State. Not now, not ever. And so every New Yorker listening, whether you live in a Republican or Democratic district, you know how to reach out, right? You know how to reach people. And there's some people I want you to reach. There's 7 Republican members of Congress who call New York home, who do represent parts of our state that are in great poverty and great need. They need a phone call from you. They need a text from you. They need social media posts to call them to do the right thing, to stand up for the people who sent them to office who believed in them. Because I know where the Democrats stand. I feel really strong under the leadership of Hakeem Jeffries. We're rock solid. We stand up for our people. Always will. We fight for our kids. We fight for our elderly. We fight for those in need. And we'll never, ever forget our duty to answer the call that President Johnson set out 60 years ago, reminding us we are a land of abundance. We can take care of our people. It's that simple. Thank you very much, everyone. Ladies and gentlemen, let me call to the podium Ken Rasky, the President and CEO of the Greater New York Hospital.
Well, thank you, Governor. Thank you so much, Governor. That's a tough act to follow, Governor. Well said. Let me just provide a couple of comments, though, to all my friends, Sandy and Nancy and Doc and all of you in labor and in management and in community. This is the fight of our life. The governor put it right. She said it exactly right. We've never seen anything like it. And the implications are tremendous. On the hospital side of things, you got two things going on simultaneously. The cuts in eligibility, which fall on the lap of the executive branch and the legislature, that back up into that, and then direct cuts on the hospitals on top of that. So it's a kind of a double whammy that you're dealing with in this. You know, and when you take a look around, and you say, these hospitals aren't in such great shape, right, Sandy? I mean, we're not in we're living high on the hog here. The fact of the matter is 3 out of 5 hospitals are losing money before it starts. They're trying to make it 5 out of 5. Is that really what we're shooting for? I guess, because that's what the House is doing. You know, and Governor, you really got it. You nailed it right. Let's broaden this beyond Medicaid. It's everybody. Every New Yorker, Republican and Democrats, in this. Because when you cut services, Sandy, you don't cut it for Medicaid patients, you cut it for everybody. And when those upstate hospitals the rural hospitals that close, they close for everybody. Mm-hmm. You know, last week, Charlie Rangel passed away. And it was sad because we've known him and you knew him when you served in Congress, Governor. What a great leader. But his final words is that we were all in this together. And by George, we're going to get out of this together. So God bless you. And thank you, Governor, for your leadership. So, Ari Moma. Ari, it's your turn. You only have to follow me. I had to follow the governor. So she's the tough one.
Good afternoon, everybody. My name is Ari Moma, member of the New York Nurses Association, one of the board members, and also I've worked here at Interfaith for over 30 years. Okay. Before I start, I'm going to thank the governor for making our time to come over here to talk to the grassroots. More so, I know Hakeem Jeffries is still on his way. I'm going to thank him too, in absentia, for all his work, for uniting all the Democrats in the Congress, for them to vote no. It's not an easy task, but he did it. And thank you for both of you for making our time, to talk to the grassroots. That's what we are. That's why we are elected here to do. Thank you. And for me to begin, as a union member and in New York, we strongly denounce the package of the bill, which is to the so-called big, beautiful bill in the House. Let me put it mildly. It is a shame that some New York members of Congress voted for it, essentially choosing the interests of billionaires over their own constituencies, which we see what's happening in Long Island and some of our congressmen that lives in Staten Island, what they voted. Above all, I want to thank the governor again for all their work they do. As nurses, we need to be very clear about the devastating impacts these cuts will have on our patients. It will rip out the health care and its funding from millions of our New Yorkers. Like we have seen posted over here, the cuts is going to hurt. It's going to take away over 7 million healthcare and Medicaid for all our New Yorkers. Half of our children who depend on Medicaid and insurance are going to lose it. Like the governor said, she's a grandma. I'm a grandpa. And I know what it takes when you have your little baby and the little baby will not have any health insurance. And you watch your baby die because he has no health care insurance. It hurts. We are in a medical understaffed area here in Brooklyn, here in Bed-Stuy, where we are the black and brown citizens of this New York. We have medical issues. We suffer for high blood pressure, diabetes, the mortality rate is high, the mental health. Where are they going to go? These patients, they depend on Medicaid. And when they call this Medicaid, what is going to be their fate? And I'm going to tell you one thing. Though we are SafeNet Hospital, when this happens, like the governor says, it's going to have a ripple effect. The hospitals are going to close. People are going to lose their job. And let me tell you what happened. Those patients, everybody is going to go to other hospitals. So nobody is safe. Emergency rooms are going to be crowded. People are going to lose their job. You have hospitals. In hospitals, you have business around the neighborhood. They depend, they feed on from the hospitals, from us. Look at the little bodega over there. Look at the canteen. When we go on our break, we go over there to eat. We go over there to patronize them. When this hospital closes, they're going to lose their job. It's not only hospitals. Businesses are going to close. These businesses are going to close. And we're talking about this is the first world nation. We are going to sink to third class. America is not going to be what we are again. We're talking about we weep for Argentina. I weep for America. We cry for America. Some cuts done here. As a nurse, and also all of us in the medical field, there are some cuts that we heal. There are some that we not heal at all. And this cut, which is happening in Albany, which is happening in Washington, if we don't do anything about it, we need to speak to all the senators, the Republican senators, because I know Chuck is close with all the Democrats. We need to get them to make sure that they do not agree with this cut. And also all our congressmen, and I'm going to tell you, when the bill goes back to them, we need them to vote the right way. No cut to Medicaid. No cut to Medicaid. And as a union, when we fight, we win. When we fight, we win. And we will not let out. We're not going to sleep. We're going to be on their back to make sure that they do the right thing for everybody when they go to Washington. Thank you very much. The next speaker, which I'm going to introduce, is going to be B. Gross, the president of Healthcare Association of New York State.
All right, I'm standing between you and Congressman Jeffries there, but welcome. Ari, I can't do better than that. That was amazing. I don't know most of you, but my name is B. Grouse. I'm the CEO of the Healthcare Association of New York State. I'm also a registered nurse and spent much of my career working in the emergency room and ICU. And I wanted to build on what Governor Hochul said about the ripple effect, but you really brought it home in that the massive cuts, the $13.5 billion every year to New York State's healthcare infrastructure is going to hurt every single community, whether it's urban, suburban, rural. No community will be untouched by this massive reduction. And the job loss is going to cut deep. As a safety net institution, you don't have any fat. And hospitals across the state really have been struggling since the pandemic. So there's really, we're already down to the bone. And this is going to hurt access to care, as Ari said, to everyone. And to underscore another ripple effect is that for every healthcare job that is lost, again, wherever it happens to be, another job in the community will be lost. And that negative economic impact is nothing short of a shot across the bow that I think will cause a recession, again, not just here in Brooklyn, but across the entire state. We have been already working. We represent, we work with Republican members of the delegation up in those rural areas, and we have been working very hard with them as the bill went through the House the first time, and we need everyone's help to double down when this bill comes back again, because we know where Leader Jeffries is and where the Democratic delegation is, but we need to pull those Republican members, wake them up, and get them to understand that this is not about just black and brown communities and just about Medicaid, and they have to open their eyes and not think about the waste, fraud, and abuse rhetoric that they have been lulled into believing, that this is a human disaster, but it is also an economic disaster for every community across the state of New York. So thank you. And it's my pleasure to introduce Michelle Ned.
Good afternoon, family. Thank you all for inviting me here on behalf of the 1199 to speak. Can I just bring this up a little bit? My name is Michelle Ned. I am a delegate and an employee here at Interfaith Medical Center for the past, I'll beat you, Mr. Moma, 43 years. My entire life revolved in this hospital. I want to say to you that Medicaid and Medicare cut is unacceptable. I have a daughter, Governor, that is autistic, and she depends on Medicaid and Medicare for health coverage. We need it, and I certainly need it. I want to say that Interfaith Medical Center, where we are right now, is part of the OBHS system, which we are a safety net. Our patients that come through our doors, they come with Medicaid and Medicare. 95% of the patients that come in our emergency room, they come with Medicaid and Medicare, 5% with some insurance. That simply means that this hospital will not be able to survive without it, ladies and gentlemen. At this time, I need some help. Hakeem, please join me. Stand right beside me here. I'm sorry. Governor Hochul, please join me. Governor, you spoke about COVID. I'll tell you about COVID. At this institution, Dr. Scott, respectfully, I would like to call on Dr. Prasanna Alston to the podium. Ladies and gentlemen, for those who don't know her, cameras, this is Dr. Prasanna Alston. She is our Chief Nursing Officer for the system. She is also the Executive Director here, interim, at Interfaith Medical Center. 2020, when our shores was hit and our doors were hit with COVID, this lady came to work with a suitcase. Dr. Scott, you knew about it. She spent 4 months in this institution and she did not go home. She never went home. This lady, from 5 o'clock in the morning, she was on the units up until 10 p.m. at night, making sure that we were protected, making sure that we had the tools we needed, and making sure that the staff was supported. And you know what, ladies and gentlemen? She was never afraid. And if she was, she didn't show it. Today, I want to present to you our hero, our COVID hero, Dr. Prasanna Alston. That deserves a standing ovation, ladies and gentlemen. Thank you, Dr. Alston. Now, this is for you, Governor. We are 1199 members, 450,000 people strong. I'm so sorry, I need to see you. We are 450,000 people strong. We presently have a brand new president, Yvonne Armstrong, and an executive, Veronica Turner. You can call on us anytime. We'll get the buses ready, and we will join you. We will fight, because this is not an option. You cannot take away what is our right. And you know what? We will stand with you, Governor. Come on over here, Mr. Jeffries. I'm sorry, Governor. Come on over here. I want to talk to you. You're from Bed-Stuy, born and raised. You don't know what it's like to be afraid. You've never been afraid. You were here a few months ago on the same stage talking about Medicare cuts. You left with an assignment to fix it with your colleagues in Washington. Obviously, it has not been fixed. One more time, ladies and gentlemen, I am giving our Hakeem Jeffrey another assignment. Go back to Washington. Tell them that we mean business. It's 450,000 of us, and we're going to get community involvement. This is no time to joke. This is no time to play. We need Medicare funds, and we need it now. You know what, media? This message is for you now. Health care is a human right. Health care is a human right. Thank you very much, ladies and gentlemen, and thank you for this. I present to you the one and only Mr. Hakeem Jeffries.
Thank you so much, Michelle, and good afternoon, everyone. It's an honor and a privilege to be back home in the 8th Congressional District, to be here in Bedford-Stuyvesant, to be here at the Interfaith Medical Center with all of you and our governor. So thankful for her leadership, thankful for her presence, thankful for her strength on behalf of all of the people of the state of New York, but particularly on behalf of her leadership here in central Brooklyn. She could be any place in the state of New York right now, 20 million people, but saw fit to be right here in Bedford-Stuyvesant, central Brooklyn, at the Interfaith Medical Center, because she knows the stakes and she cares about all of you. She cares about all of us. So thankful for all of the participants today in this critically important hour as we fight to defend the health care of the American people. You know, the GOP tax scam is not one big, beautiful bill. It's one big, ugly bill. Yes. That will hurt everyday Americans, hurt everyday New Yorkers, and it's designed to reward their billionaire donors like Elon Musk. It would visit upon the people of New York and the American people, the largest cut to health care in American history, the largest cut to Medicaid in American history. Children will be hurt, families will be hurt, seniors will be hurt, everyday New Yorkers will be hurt, people with disabilities will be hurt. This one big, ugly bill that they're trying to jam down the throats of the American people is unconscionable, it's unacceptable, it's un-American. And together we're going to do everything possible to stop it in its tracks and bury it in the ground, never to rise again. They want us to step back. We're here to make clear we're going to fight back.
Right.
Now, this bill limped out of the House of Representatives by just a single vote, which means that any one of my Republican colleagues in New York could have stopped it.
Right.
Any one of them could have stopped it, because every single Democrat in New York, every single Democrat in the country was strongly opposed to it. And that level of opposition you're going to see in the United States Senate. And so this is just the beginning of an ongoing struggle to protect Medicaid, protect Medicare, protect the Affordable Care Act, protect the health care of the American people. Our message to the members of the United States Senate, our message to Donald Trump, to J.D. Vance, to Elon Musk, they want to take a chainsaw to Medicaid. They want to take a chainsaw to Medicare. They want to take a chainsaw to the Affordable Care Act. We're going to take a chainsaw to Project 2025, no matter how long it takes. And we can start by stopping this one big, ugly bill, because it's straight out of the Project 2025 playbook. Here in New York, in America, certainly in our communities, we don't believe that access to high-quality health care is a privilege. No, access to health care in New York, thanks to the leadership of Governor Hochul, access to health care in America is a right that should be available to every single person, which is why we're fighting hard to protect Medicaid and Medicare and the Affordable Care Act, all of which are on the chopping block at this moment in time. Now, in 2017, they tried to repeal the Affordable Care Act. And similar to what happened then in the House, the bill limped out of the House of Representatives after a few failed efforts, just like it's limping out of the House of Representatives right now, went over to the Senate, where we had an opportunity to finish it off with unified Democratic opposition and just a handful of Republicans at the time, including John McCain, who did the right thing. And so we're calling on just 4. All we need is 4 Republicans in the United States Senate. There are 53. All we need is 4 to do the right thing. And so we're going to make sure that our voices are collectively heard, led by the governor, led by Ken Rasky, led by 1199, led by this great coalition as we fight to protect the health care of New Yorkers and the health care of the American people. So I'll close with one simple message, a message that wherever I am across the country, whenever I'm on the House floor, we make clear we don't work for Donald Trump, we don't work for the extremists, we work for the American people. We work for the American people, all of you, and that means keep your hands off the health care of the American people. Keep your hands off our Medicaid, your hands off Medicare, your hands off the Affordable Care Act. Keep your hands off our health care. Hands off today, hands off tomorrow, hands off this week, hands off next week, hands off this month, hands off next month, hands off this year, hands off next year. Keep your hands off our health care forever. That's our charge, that's our mission, that's our goal, that's our objective, and we will not rest until it's accomplished.
That concludes our program. Thank you for attending. We look forward to seeing you again.
Program coming up. Yeah.